depression, but it's like
There we go. Sorry. Angie and I was talking about her bright sweater. I was like, Angie, I love your bright sweater.
Yes. I said this sweater is so appropriate for this conversation that we are getting ready to have. First off, to everybody that's tuned in, good evening to you. Thank you so much for joining us. Everybody, welcome. Lock in. Tell your friends. Tell them get on, because we're about to have a awesome conversation that is so needed in these holiday times. Today, this time around, it's minorities and mental health, healing through the holidays. And the two people you see, we love you. We care about you so much that we get on the radio every day to bring you love, to bring you light, hence the really bright sweatshirt. I go by the name of Angie Edge. You can catch me in the mornings on the Morning Hustle Show, 6 a.m. to 10 a.m. And then as soon as we're done on the radio on 92Q, we pass the torch to the one and only Persia Nicole.
Hey, shout out to Ange right there. So right after Morning Hustle, I come on at 10 a.m. to 3 p.m. middays with Persia. And like Angie said, every day we get on the radio, and we're super excited to make sure that you're healing through these times, and also ourselves too, because honestly, our listeners really help us heal too. Like, you get on, you hear other people's stories, and you're like, yo, okay, like, I can do this.
Yep. Absolutely. Yeah. And holidays, we know, can be really, really tough for people going through it. And especially this time around in this pandemic and with everything that's going on. And I was telling Persia, she was giving me love on my bright colors. And I told her, like, in the seasons like this, when it gets dark and it gets rainy and cold and snowy, like, I'll deliberately put on brighter colors because it helps brighten my mood. Because a lot of times, like, I feel when it's dark outside all day, I feel low. When it's like sunny, I feel better. So sometimes I have to bring the sunshine to myself, even if it's with color in my wardrobe. And so I'm really looking forward to the conversation. We got some great guests that are going to join us. And so we might as well get right into it so we can get started.
Let's do it. So before we get inside this amazing discussion we're going to have tonight, we're going to introduce some of our panelists. First up, Dr. Elia Jones with the Maryland Department of Health. Dr. Elia, how are you?
I'm very well. Thank you for having me this evening, ladies. How are you?
We're great. Awesome. So explain a little bit about what you do over at Maryland Department of Health.
Sure. So I'm the Deputy Secretary of the Behavioral Health Administration, which means that my administration oversees all of the public behavioral health system in the state of Maryland. So ensuring that all of our citizens have access to care, treatment, and services as needed, those in the public side, but then also in some part for those who are not a part of the public behavioral health system as well.
Awesome. Up next, we've got Dr. Carla Debnam of the Renaissance Center. Good evening, Dr. Carla.
Good evening, everyone. I'm glad to be here. And I am the Executive Director of the Renaissance Center, which is a Christian counseling center in Woodlawn, Maryland. And we've been in existence for 19 years. And we serve the entire community. We accept insurance. We see all populations, couples, families. And we pride ourselves also as being a site where people can do their internships to further their education in the counseling and social work field.
Nice. Thank you for everything you do. Next up, we have Rachel Dulcine from RJ Designs. Hey, Rach. You're muted.
Are you on mute, though?
Oh, sorry.
Here we go.
That would be helpful. Hi, everyone. How are you?
Good. How are you? Explain a little bit about what you do over at RJ Designs.
So I am a crafter, and crafting has helped me through my anxiety and depression. And so I love to share. I have virtual crafting meetups every month. I have crafting boxes that I send to folks. So I want to talk about how that has helped me during my the seasons like now when I experience depression, as well as how it's helped with my anxiety.
Awesome. Nice. We also want to bring in Dr. Terry Griffith as well of Shepherd Pratt, who is our psychologist.
Hi, ladies.
Good evening.
Thanks for having me. Good evening. This is such an important initiative, so I'm really happy to join you. I am a psychologist at Shepherd Pratt, and I run their intensive outpatient program on the eating disorder unit.
Nice. Thank you, Dr. Terry. Next up, Beyonce. And we're not talking about Mrs. Carter, the other Beyonce, the other gorgeous one for the Ricky Smiley Boy.
I'm older than her, so
Oh.
I had a
Okay.
first. But hi, I'm Beyonce. I do a technology report. I do what's hot in technology, typically Techie Tuesday. And, you know, there's some really cool ways that people don't know, especially in a pandemic and while you're at home, apps and different ways that you can even talk to therapists and get help. And so, you know, I've been doing a lot of research, so we're going to talk about that.
Okay.
Yep.
I'm excited about this conversation. Thank you all for joining us tonight.
So we want to start off first and foremost. A lot of times we as a people, we don't recognize the signs, and that's very important to recognize the signs when it comes to depression. I'll start with Dr. Terry Griffith. Can you talk to us a little bit about signs of depression?
Definitely. I think that's a great question. And it's tough because you can look at someone who seems to be happy, functioning, and they could be clinically depressed, right? But I think for everyone, it could be good to assess some of the significant changes that you're seeing in your day-to-day functioning, and maybe some things that might be non-conventional or less obvious, right? So one sign is your sleep patterns. Having a hard time falling asleep or staying asleep, or having difficulties with sleep in general could be a sign of depression. Shifts in mood to where it's difficult for you to sustain interactions with individuals. You know, having the urge to isolate. You know, mental illness is a secretive illness, right? And so isolation is where it thrives. So if you have family or friends who are, you know, not answering the phone or not making, you know, their appointments or not sustaining their day-to-day responsibilities, that could be a sign. There's a lot of different signs like related to eating, you know, having a hard time eating, eating more than you usually do or eating much less than you usually do is a sign. And there's subtle things that you might see in someone in their personality and their demeanor that could be indicative of something going on. So for everyone, I really encourage people to be introspective and really think about how they're functioning and saying, hey, maybe something's wrong and maybe I can get help for this.
Yeah, absolutely.
I think the hard part too, when you recognize that, like you said, sometimes you have problems sleeping, right? But you may think it's one thing, and you start to medicate a little bit. Like maybe you pop an Advil PM, or some people might smoke a little something, and you know it starts off as just kind of, sometimes you take a drink. Oh, I just need a drink, and then it starts to kind of become excessive. And so I'm curious about, like, if let's say someone just heard some of those signs and they're like, that sounds a little bit like me. I think the other problem is being able to say, like, is something wrong with me?
Yeah.
You know, what becomes the next step if you just heard that, someone has just heard you say that and they know that's them, but it's like, I'm not crazy, you know, that kind of the next space.
It's so hard because I know everyone here is familiar with the stigma around mental health and wellness, right? But if someone is questioning if something's wrong, something's likely wrong. And I just want to urge people to recognize that there are so many resources and people who are willing to help. Even if it may be calling a friend to have that friend help you make that first phone call to a therapist on Psychology Today, or listening to this platform that you guys are doing right now, right? Or just doing research around resources in your area. You know, at the end, I'd love to share some resources that I have. NAMI and Shepherd Pratt are great resources. But I think if you're questioning if something's wrong, something's likely wrong.
Yeah.
Right. And there's many people who are willing to help you. It just takes a click or a phone call.
Yeah, this is round 2 of our minorities in mental health. And I know the first time we talked about mental health within a Black community. And I think a lot of times within our community, you know, we say, well, you know, it's okay. Like, you know, I feel this way, but, you know, we kind of just push it to the side. Is there like a spike in mental health when it comes to the African-American community compared to another community? And somebody else wants to jump in as well. We can kind of all have this conversation.
So if you're talking about spikes in general and rates of behavioral health conditions in the Black community, our rates of behavioral health conditions are normative to other populations. However, our experience with behavioral health conditions is different. And that's in part because of the stigma that Dr. Griffith mentioned. It stops people from getting help earlier. And the longer you have a behavioral health condition, there are usually consequences that go along with that. So for example, if you have depression and you have a hard time working, well, going through phases of periods of your life without working, we know impacts your financial status. Your financial status affects all sorts of things, right? Or having depression while you're raising your children affects your relationships with your children. So it affects all different parts of your life, and having all those impacts, they add up over time. And so when we get into treatment later, or we recognize disease later, sometimes it's harder to treat because it's gone for such a long time without being addressed, and or we have just more life stressors that make it harder. So it's like you've got more bricks on top of those natural bricks that you have to deal with. So so that's part of the challenge with behavioral health conditions in the Black community, and why it's so important for us to move past the stigma that interferes with our acceptance that there might be something wrong, and our rejection of help when people are trying to get us to reach out and get some support.
I want to pose to the panel too, as we head into the holiday season, is there such thing as, because I've heard of seasonal depression or things like that. I was just talking about how I'll deliberately wear brighter colors during winter months because it's dark, and when it's dark and it's raining and it's snowing, I don't feel the way I feel in the summertime when it's lit and the sun's up till 9. Can we speak a little bit to seasonal depression and dealing with that, identifying that, and is that something we should be really concerned about in this time? I'll go to Dr. Carla. Let's start with Dr. Carla.
Seasonal depression is a real condition and disorder that many people have, and it does start, as you said, with the shorter days, the darkness, also the weather changing, but it can be treated. There's light therapy. There's also, of course, traditional therapy that persons can utilize, with their therapist, but also you can take steps if you already know that you suffer from this condition every year, right around the same time. You can take steps to prepare. And what happens is people don't prepare. They know their triggers in some cases, especially with seasonal affective disorder. Your triggers are the seasons, the shortened days. You can take some steps. You can, make sure maybe you have different lighting in the house, do some aromatherapy. It's other things you can do to kind of mitigate the effect of it. Like you're saying, wear brighter clothes. It's things you can do that are practical. A lot of times people say, well, I don't have the money or the resources to take care of my mental health. Well, some of the things that we can do, practical things such as eating properly, exercising, meditating, those things can help alleviate many of the stressors that can lend itself to seasonal affective disorder and some of the other ones as well.
Yeah, I know me. I love candles. So different seasons, I bring out all my seasonal candles. So like when it comes to the wintertime, I love all the different aromas, and it just makes me happy. Like, you know what I mean? If you've had a long day, you light you a good candle, have a nice glass of wine. That's my thing. That's what works for me. I know, Rachel, your thing is crafts. So what are some crafts that you do to kind of help you heal and kind of feel better, relax throughout the day?
Oh, absolutely. And I love crafting, and I have the seasonal. So Angie, I'm right there with you.
Okay.
And this is one of the reasons why I started crafting, because I didn't want to take more medication. And I didn't want my doctor to change my medication. I was going to therapy every week. I was taking medicine. I was taking some steps. And so crafting became a part of my anxiety and my depression care plan. And so one of the things that helps me when it comes to crafting is picking a project that you can do over time. So I actually have one of them. My favorite is to make a rug.
Wow.
That's nice.
Yes.
Okay.
So this can take between 2 days to 2 months, depending on how my anxiety is. So every time I get anxious, I'll pull the rug out and I'll do a couple rows. And this is items I buy from Joann, some yarn and some plastic canvas. And I make a rug for my back room. And so one of the things for me is a project that over the course of time, something that when you look at it, you remember what it means. So another project I've done is I miss my sisters. So this is wood, and I transferred a picture to wood. Wow. And so I miss my sisters. This is in my office, and I have it there. And every time I pass it, I think about them. But the act of actually doing these projects helps to calm your mind. It takes your mind elsewhere because you're focused on looping the yarn through the holes. You're focused on painting or transferring the paper to wood. So these are just two of my favorite. I have lots of rugs, obviously. I give most of my projects away, but it's really a way for the brokenness you're feeling in mind, the chaos, to bring order to it, because your mind gets out of control with anxiety and depression. And so for me, creating this helps to take all that chaos, all that craziness, and turn it into something beautiful. And then when I'm done, to show it to other people and they say, wow, Rach, that's really amazing. That's beautiful. You're so talented. Helps, because affirmations is my love language. So it helps to kind of ease me and let me know I'm valued, I'm loved, and what I'm doing makes a difference, even though it's crafting.
Were you always good at it? Yeah. Was that always like something you did and you just kind of, or were you like a beginner? Because like I have no creative ability like to begin with. But I felt like, can you start from scratch, or was it already in your spirit?
Absolutely, you can start from scratch. I actually have crafting boxes that I send folks that have all the supplies and the instructions. Okay. For doing a different, so from projects from glass etching with no machine, all the way through making a rug or making a pillow. If you have no sewing skills and it requires no sewing machine. So you could absolutely be a beginner crafter, and you can create things that are just for you. You can make your own candle, you can make your own bath salt. You can color. I have a coloring book next to my bed, and my husband thinks I'm odd, but that's okay. While you're coloring, you're like 41, but it helps. That's my stay out of jail plan. And so absolutely can be a beginner and do any of the projects that I do.
I love that. She can heal and make money at the same time. That was amazing. Yes. I love it.
I think that, what Rachel's speaking to is just doing the things that make you feel better, right? And so for her, it's crafting. For someone else, it could be prayer. It could be exercise. It could be meditation. It could be cooking, so I'm just doing the things that make you feel good and make you feel more in control of your personal experience at that moment. Because feelings, emotions, for most people, and not, if you have a severe and persistent mental illness, that's different. But for most people, if you're riding through life, you're going to have negative emotions from time to time. And you have to have something, and particularly now as we're going through COVID, to have something constructive to do with that energy, something constructive to do with your health, with your hands and with your mind, while you're waiting for that negative wave to wash over you and you're into a new and a better space. But even if you do have a persistent mental illness, those activities are even probably that much more important, right, Rachel?
Yes. Absolutely. Yeah. Absolutely.
Why do you think we do default though to the negative behaviors first? Like I feel like again, a lot of times it's self-medication. It's going to be drugs. It's going to be alcohol. It's going to be sometimes sex. It's going to be like kind of destructive behaviors sometimes that we shouldn't be doing. Why do you feel, and can the panel speak to why a lot of times we go that route, and how do we shift? How do we shift into something more positive first instead of like going the destructive route?
Terry, did you want?
Yeah, I was just going to say, I think because of avoidance, right? When we experience difficult emotions, it works to avoid, right? But it works in the short term. So avoidance could be used through self-medication, having people be a distraction from the feeling, diving into work and just being very, very busy to not tend to the emotion. But avoidance works until it doesn't work, right? And so when it doesn't work is when all the things are away and now we're left with ourselves. And so with depression or even seasonal depression, you really want to use what our body has, those happy chemicals in our brains, right, and activate them. And I liked what Rachel was talking about, engaging in things where you can experience pleasure, so that we can feel that dopamine, the oxytocin, the different chemicals that make us feel content and happy. But I think we're drawn to the negative because it works, in the short term. And it takes work to rewire ourselves to do the adaptive coping skill that might take longer, but that is much more helpful for us in the long run.
And I would add to that is that we do what we know to do, right? So if you have, pleasures that you engage in that aren't healthy, well, you're not thinking over the long term that this is going to be a problem for me, right? You're thinking that, I drink a little bit, so I'm going to drink a little bit more. You're not, most people are not purposefully trying to avoid, though it becomes an act of avoidance, right? So they're just trying to do the things that they know to do, which is why it's so important to have people to talk to, why it's so important to have a therapist, to have a friend, to have a pastor, to go and to talk to, so they can give you some healthier things to do. Because oftentimes people don't realize that they are engaging in avoiding behavior. So I think that my experience has shown me people, they just don't know the track in their mind plays one way, and you need somebody else to put some other tracks in there.
And I agree with Dr. Jones, because I know for me, it's taken a variety of different tools. So going to therapy has helped me to grow my toolbox. So it's not always crafting. Sometimes it's listening to music. And even though I'm Jamaican, I have 2 left feet. I cannot do any type of cooking. But when no one's looking, you pretend you can. For some, it may be meditation or prayer. So I think sometimes we go to things that are unhealthy for us because that is all we know, and we don't have any other options in our toolbox. And I will say this, prayer is not the only way to manage mental health. And we have that in the church. I grew up in the church. It's not. And I did that for years, for decades, and made myself so much sicker because that's the only tool I had was to pray. And when that wasn't working, what did I do? I had to turn to something else. And so I do agree that growing that toolbox, building up that toolbox is so important, so that you don't go to some of these really negative and destructive behaviors.
I think people also use the negative means of escape is because of stigma. So it's more stigmatizing to grow a toolbox, to reach out for help, whereas it's culturally acceptable, to, go to happy hour, to, drink, wine, to wind down in the evening. And then that becomes more habitual because it is effective. Like we said, it works, but it's temporary. And growing that toolbox is important, but we first have to bring down the stigma so that the unhealthy ways of coping, we can combat them with more healthy ways. And I like what you said about, for a long time, people were pushing their spiritual practices only, prayer, if you go to church, all those things would help you overcome your mental illness. Now people are more aware and say, okay, I have prayer and a therapist, right? We see that trending. Or I have prayer and I pray over my meds before I take them. I am also participating in my health. And, studies show that going to people congregating for their different faith traditions does help with the mental health, but it's not the only help that people need. And we, as persons in the faith community, need to push our congregations to seek help when it's needed. And I think more persons are doing that now.
Well, it's like your grandmother said, just pray about it, baby. Just pray. Just pray.
Right. Pray will heal it all. I see Rachel down there shouting. I want to remind you, as you are watching live right now, you can submit questions so that we can ask some of our experts, and you can get some things answered that you've been wondering. Beyonce, let's talk about from the tech side, like some different apps and things like that we can use to stay connected with our family and our friends, especially right now during the holidays. We all want to stay connected. Zoom has been like my BFF. Okay.
Yes, Zoom.
Yes.
And there's some. Did you know that there's a friendship app? There's a friendship lamp and they've actually got them on sale right now. And so what the friendship lamp is, it's really cool. Like, say, you know, you got your mom, your sister, your cousin, your best friend, you know, one's in Chicago, one's in Atlanta, Baltimore, and DC. I hit my light and it fell.
Oh, so there go the friendship lamp, honey.
I'm talking about lights and it fell. So, you know, if you touch the light, what it's designed to do is to make the people that you love know that you're thinking about them, so that they can feel a little warm and fuzzy. You know, they might be going through their day, or, you know, having the kids all day, and they see the light up, and it's just like, oh, okay, at least somebody's thinking of me. And especially, you know,
I love that.
It's super cool. Now, for me, I actually, you know, this time last year, I had my 1-year-old, and I had never heard of this before, but it's called postpartum anxiety. And I just know that I felt off. You know, I'd never been one to go talk to a therapist. I have never talked about this. Never been one to go talk to a therapist or anything like that. Or, you know, I was like, oh man, I can handle this. And, you know, I don't need to express my feelings. I'm okay. But, you know, for women, for mothers, this can come on before pregnancy, but a lot of times after pregnancy. You don't have to have any kind of mental health illnesses before that or anything. And, you know, I just kept feeling so anxious, and I couldn't understand why. And apparently it's like a thing that, and, you know, people don't talk about. They talk about postpartum depression, because I kept telling my doctor, I was like, well, I don't feel like hurting myself. I don't feel, you know, sad. You know, like the first thing they'll ask a mom once you have a baby is, do you feel sad? Do you feel happy? Do you feel like your life is in danger? And I was like, no, I feel fine. I feel happy. I feel anxious. Well, anxiety is a form of postpartum depression. And it's, you know, people are really just now starting to talk about it. And so there are a lot of apps and even games that I would play to kind of like keep my mind focused, so that way I wouldn't let it get away. Kind of like Rachel was talking about, you know, with her rugs and stuff like that. So, you know, meditation really helped a lot. And there's some really cool apps, you know, for anxiety. Like there's one called Mind Shift, and, you know, it's designed for teens and young adults with anxiety. And, you know, it really kind of helps you like fight your anxious feelings. There's also Sam, and what Sam does, it's called Self-Help for Anxiety. And basically it kind of helps you with your meditations as well, but you can also have a chart. So as you go throughout the day, you can write down your feelings and negative thoughts, and, you know, see if there's a pattern, or see if there's something that, you know, you need to take out that could be triggering these emotions and these anxiety feelings that you've been having. You know, there's also some really cool apps. The Calm app helped a lot. And, you know, for those people who have been going through depression, and, you know, you need to talk to somebody, there's a really great app called the My3. You know, and what My3 does is it's got the National Suicide Prevention Hotline attached to it. So if there's ever a time that, you know, you need to talk to somebody, you know, you're just really kind of feeling at your wit's end, My3 is really dope, because, you know, the people, they're very kind. We've done a lot of work, you know, with raising money and funds from the National Suicide Prevention Hotline. And, you know, they're there for you. And I know sometimes you'd be like, oh, I don't want to talk to nobody, but it helps. It's kind of like, you know, sometimes if you're in the house and, you know, even how Ann said, you know, just wearing a different color brightens your mood. Going outside might brighten your mood. Well, talking to somebody and just getting whatever it is that's on your mind helps. And so My3 is a great app. And there's also, you know, all types of apps to where you can journal. Journaling for me really helped me a lot. And so some of the journaling apps worked. Also, there's the Mood app. And, you know, I'll list all these I'll send them to Persia, so, you know, you guys can put them on the website and people can check them out as well. So, but yeah, so, you know, find something that, you know, you can focus on and really hone in on. But to all my moms out there, I think the one thing that I learned out of all this is it's okay to not be okay, but you will get through it.
Absolutely.
Yeah, I was writing down the apps as you was talking. I was like, okay.
I know.
I love the lamp. It's called the friendship lamp.
It's the friendship lamp. And I actually saw it on sale yesterday. Like they have them on sale. So like, you know, you could go, it's kind of like, you know, back in the day when you had like the best friend bracelets and necklaces.
Yeah.
And that way, you know, at nighttime, you don't have to send a text. You just tap the lamp and it lights up and be like, oh, Ange thought of me. That's just so your friends think that you're thinking about them. So yeah, it just keeps you a little warm and tingly.
Mm-hmm.
I think that's super dope.
Can I add one app? Can I add one app to her list? Okay. So the color by number. So if it's I have a coloring book, but they have the color by number app, and it's pictures, and you tap the numbers and the colors so you can color a picture. So that's one of the things I use at night when I'm really anxious, and sometimes I color 5 pictures, sometimes 10. But that's an option to a coloring book, is color by number, and you can find it in your app store.
Guilty pleasure admission.
And it's free.
When I was in the hospital, Candy Crush was my go-to app to keep me. I hate to admit it, but like it really does, get your brain thinking about some other things. So yeah.
Yeah. For everybody who's tuned in right now, we want to welcome you and thank you for being a part of this conversation. Very important conversation, minorities and mental health, healing through the holidays. Now, when it comes to holidays, the number one thing at the list beyond gifts and all that is family. And with family also comes family issues. And so I want to get for the panel, pose a question that we got from the comments about coping with family matters during the holiday season. Thank you, Kelly, for that. The question is, how do you cope with family matters during holiday season? I'll start with Dr. Terry.
Yeah, so I think that's a good question because, we're in a pandemic, so a lot of people want to feel connected to family, whether it's the family that they live with or virtually. And it's tough when there's family conflict because that creates a barrier and a threat for that connectedness with them, right? I think one thing that I really think is important is just to have the conversation and to not feel the need to tiptoe around some of these discussions, because if it festers, it could become bigger, so it might be just making that phone call and saying, you've been on my mind. I wanted to kind of talk about this with you, or writing out a letter and kind of formulating your thoughts and presenting that to them. Bonding over an activity, and having that open up the conversation. But I do think if we avoid, the issue or the situation could become bigger. And so using supports, whether that's your own mindfulness before having those conversations, having the support of a friend, but really approaching the conversation and trying to do so so that it doesn't create bigger issues. Excuse my dog.
You about to set my dog off because if the dog gets that,
everybody start barking after that.
It's about to be on in a minute. He's sleeping right now, so I'm praying.
Right, Ange. Let us see the dog, Ange.
He's on the floor.
Well, he's on the floor. He's so cute.
And then he's like camera shots. If I turn it, like he might. I just don't want to set him off right now. He's a little Yorkie, so he's like he has his own mental health issues about being little, and it's tough.
I had somebody tell me the other day, and when you think about the holidays and to be with your family, sometimes it's always like that one question to the single folks is, when are you going to get married? Or when are you going to do this? So one of my friends was like, one thing she can take from this pandemic is not having to go to her grandmother's house and then asking her when she's going to get married. So she started to think about the positives with this, because it's negatives. We all want to be around our family and our friends, but she don't have to go through that conversation again, So I think that might be kind of a good idea to cope with, not being able to spend, family time this holiday.
And the other thing I would think about the fact that, over 300,000 people have lost family members over the past year because of the COVID pandemic. And when we think about our own family and the issues and the challenges that we face, we're still here, right? And to try to have a little bit of a different perspective, we might not always agree on everything. We might not like everything that everybody does, but we do. The fact that we want to interact with one another means that there's a love there, right? And let's focus on the love. Let's focus on the part where if this person was gone, what would life be like? And think about that and help to reframe and reshift this moment. That's something that you can take away from this moment. I would rather be here and have this fight with you than have you or me gone. And so we're going to focus on the fact that we love one another and we're going to find a way to get through this moment. and just be patient with one another through the process. Because family problems don't go away, and COVID honestly has made a lot of family challenges worse. You know, relationships have become harder because we're not seeing one another, or we're seeing too much of one another. It just, you know, it just depends. But, you know, I think we should take advantage of the lessons that we can learn from this moment, and really, you know, find the love that we can express now that we wouldn't be able to express if that person were not here.
Dr. Jones, I'm glad you said that too, because we have another question from the audience. And definitely keep the questions going. Like this, this panel is for you. It's about you. You got some great people here who love you and can provide, give you answers and provide support for you. This is a very important question, I believe, because you said like some of us are around each other too much right now. Someone wants to know, how do I let people know I need some me time without them feeling some type of way? I call it Ange time. Clara, I understand. When Ange says I need Ange time, leave me be.
Please.
Can we how do we communicate that to the people that we love without hurting them? I think that's a great question.
Well, personally, I would just be honest about it. You know, I would start with your disclaimer. I love you, and you know, I love for you, and this is not about you. This is really about me. And there, you know, I need a minute. You know, I need, you know, I've had been taking care of kids all day and working, and I'm done, and I need some time for myself. So I want to be my best you when I'm with you, but I need a minute. So, you know, I need some downtime. And sometimes it's good to kind of give a boundary, you know, like every day between this time and this time, I'm going to have time to myself. Or, you know, if I turn this light on, this means I'm in this kind of a mood. Or if I put this music on, this means, oh, she doesn't want to be bothered right now. If she pulls out her Bible, that means don't disturb her. Yeah, sometimes, you know, you give yourself those outs so that other people, so you don't have to be so abrasive and say, I need some time to myself. But I think it is important that you have those boundaries and that you create those boundaries with the people that you love. If they love you, then they will respect. It might be hard, but they'll get over it.
Yeah, I love the music idea. It's like, you know, if you hear Keisha Cole, don't enter the room. Oh, you got Keisha on. Let me go ahead and go to the left real quick. Like, that's a good one.
Yeah. And I just wanted to add, you know, I was thinking about boundaries before that question was asked. And I think we should just normalize having boundaries in our community. As a community, we are quite enmeshed, you know, within our family system. And one thing that people fail to realize is that boundaries enhance relationships. Boundaries are built in place to make the relationships better. I was talking to my patients today about different communication styles. If I'm able to assert myself and assert my boundaries, that's so that we can have a good working relationship or a good familial relationship or intimacy. And so just not feeling badly about setting those boundaries, I think is really important. And I think that's going to look differently for every person depending on their communication style.
And if you're a mom like me, setting boundaries sometimes used to, not anymore for me, but it's associated with guilt because you're a mom and your child needs you. Now I have a teenage son and he's an only child, so I guess he thinks I'm his BFF, but I'm not. You know, it's kind of like this always need. And so one of the things I agree, boundaries have been really important for me, even with helping to manage my guilt, my mom guilt that comes with, oh my goodness, you're telling your child you don't have time for him right now. And so one of the ways my therapist has helped me to reframe that is I am modeling for him what setting boundaries is and why it's important and what it feels like when someone sets a boundary for you, especially as a man, as a male, that a boundary has been set. It should not be crossed. So I'm modeling for him what that looks like in a relationship, in a loving relationship, but also what I'm seeing now is when he's overwhelmed or when he needs a break, he feels comfortable saying, I need 5 minutes or I need 10 minutes. And so that has helped me to manage and to grow and to become comfortable with boundaries, because it's not just for me, but I'm modeling for my child that it's okay. And then hopefully as he becomes an adult, that's a norm for him. I'm normalizing boundaries and what that means and what it feels like when someone sets a boundary for you and how you manage your own emotions as well.
Yeah, I think that's a really good point about how he's responding to your setting boundaries. And then as parents, and particularly as Black parents, we have to be careful that we respect those boundaries that our kids are at, right? It's not, well, but I said, it's
Right.
your boundaries. No, you don't get 5 minutes. You get 5 minutes when I tell you you have 5 minutes. No, it's not like that.
Right.
You get 5 minutes. Okay. I'm going to give you that space. I'm going to respect your space the way I want you and expect you to respect mine.
Exactly.
Yeah, I think this boundaries is a really good topic. A lot of times with my clients, that's one of the main things we focus on, is because they don't have boundaries set, that many of their lives do become chaotic and out of control. And it does, again, become hurtful when you do start setting boundaries with family and friends, but it's necessary. It's no way to continue some of the activities and things we're doing. And now that we're working from home, parenting while working and doing so many different things, boundaries are more important. And so it's just some people are going to take it personal because they're not used to you setting boundaries, but it's okay. And maybe you'll start a new trend in your family or friend group, and they'll be like, okay, I see the music, I hear the music, the candle scent, whatever it is. And you can even tell people, if you hear Keisha Cole, don't come in here. That's it. If I'm listening to whatever, that's my me time.
Yeah.
So I have a question, for the doctors who might. There are a lot of parents out there, of course, who have the kids at home now, and both parents are working from home, and you want to set boundaries in regards to your own personal space. But how do you, I guess, set up a workflow between, if you and your partner both have the same work schedule, you're also trying to get the kids in school virtual learning. I know that there's been, a trend on Twitter. Even at one point, people were talking about Kim and Kanye, and Kim felt like she was doing the majority of the parenting, and Kanye wasn't pulling his weight. How do you discuss with your partner, in a respectful, boundary-ish way, hey, I need you to do this part of the load as well,
So I think that's a communication issue, right? So I think that any parenting unit needs to sit down and have the conversation about how are we going to do this? What's the plan? And then the two of you, however many adults there are in the room, need to come together and figure out, is one person going to carry the bulk of the weight because that's, maybe because one person has more flexibility with their work schedule than others, or are we going to share? And if we're going to share, what exactly is that going to look like so that we're not creating conflict amongst one another, and so that the kids are not frustrated because they don't know who they're supposed to go to for help. So I think it's about, talking, having a plan, and everybody agreeing to, this is how we're going to make this work. The other thing is, we've all been doing this for quite some time now. Hopefully by now you've had the conversation, if you're working from home, with your employer about what the expectations are for work, because hopefully by now they recognize that you can't do two things at one time, or at least you can't do them well, and that you might need some flexibility in your schedule. Maybe you start later and you work till later, or maybe you break your day up a little bit more. Personally, since I'm working from home and I have my 3-year-old in daycare and I have my 10-year-old is virtual since March, right? So I have time in my day for my daughter, so I can check in with her and make sure that she's doing what she's supposed to do. And I have, order lunch on my schedule so I can make sure that, lunch is coming, because I'm not the world's biggest cook. So DoorDash, we're doing a DoorDash thing. So, I have that on my schedule so that I make sure that she is a part of my day, and that she's taken care of. And when my husband's home, he's helpful. He helps a little, but we have a traditional relationship, and that's just how it is. But she's doing, and now that we've adjusted and we know what we're supposed to be doing now, everybody knows their roles. We're all doing a really, really good job with it. So be patient with yourself. This is a really hard time, but have a plan.
Yeah. I want to also, since we're talking about children, a good question that came up was depression in children versus adults and those differences. So for parents and even anyone who's taking care of young people, grandparents, providers? Like, can we speak to the differences when we see depression in children versus adults, or is it all kind of the same?
I think it is similar in a sense, but you might see with children more acting out behavior, right? The child that the teacher might be saying, is not behaving, in class, or is, monopolizing the group, or doing things that aren't characteristic of the child. Sometimes children, they're not as advanced verbally as we are, so they don't know how to express what's really going on. And it could be very confusing for a child to have this shift in emotion and difficult moves that they're experiencing. So they might act out, or they might shut down and internalize, or you might see other behaviors like bedwetting and things like that are indicative of something going on. But again, just like older adults or like people our age, you might see the similar like difficulties with sleep, shift in mood, and things like that. But I think for children, they're not able to express what's going on. So it's really the duty of the caretakers to really try to notice if there's differences in their demeanor, and trying to see if they can have someone to talk to. And of course, therapy with children is very non-conventional. If a child comes into my office, it's probably something like giving them a piece of paper and asking them to just draw and seeing what comes out of that, or asking them like how their day has been, and then from there processing more. But I do think if you notice any subtle changes, that could be indicative of maybe some depressive symptoms.
Yeah. Let's have the conversation of social media. So I know a lot of people say social media causes depression, and it really is like a monster when it comes to it. And other people say social media actually helps my depression because I have somebody to talk to. Because you see a lot of different people, like they put all of their emotions on social media. You're like, oh my God, like go talk to your friend. Why are you telling us all of this? But that's their way of reaching out and saying, hey, I need help. I don't have somebody to talk to, so I'm going to go to my followers and say this. So what is your thoughts on social media and depression?
So I think it depends upon the gender of the person and the age of the person. So if you're talking about a young person, particularly young girls in social media, there's a lot of research that's showing that social media is detrimental to young adolescent girls. So that's the age and the gender part. The other thing is what research is also showing is that it really depends upon how you use the social media, right? And that's what you're speaking to, Bridget. So there are people who go on and they're voyeurs and just watching everybody else's life and not participating, versus people who put themselves out there or who share and talk about what's going on with them. Folks who are participatory in social media actually can find social media to be very helpful, versus people who are more voyeurs and looking at everybody else's life and comparing out, they're doing this or they have that or they're doing all this fun stuff and I'm just stuck here in the house and I'm not doing anything and my life is boring. And even though that person's life is probably just as boring, they're just telling you a little bit of stuff that they're doing, right?
Okay.
That they want to do. So, if you're more participatory, social media actually can be very helpful, as opposed to just looking at everybody's life and comparing it to yours. Then it tends to make people more anxious and depressed.
Yeah, I think that's so true, because people are presenting sometimes their best selves, or like you said, just a small window into their lives, and the highlights. I'm posting the highlights. I'm not posting, when I stayed up all night and wasn't able to sleep and couldn't find my way. You get those rare posts with people sharing those things, but most people are posting, I'm great, my family's great. And then, this what gets me, of course, from a therapist perspective and a church perspective. It's like, wait a minute, didn't I just talk to you? Now you posted this like fake post. That's what I'm saying. of whatever. And I mean, I'm saying in my head, but it's kind of like, that's not healthy, because if you're processing, your issues, and then on social media, you're saying life is great, you have to come to terms with that. And so that's what I think is causing people, because they know that their life is what they would like it to be. So they're, have a false self that they're promoting.
Realistic expectations. It's kind of like, the magazines, how people, were complaining about, the airbrushing and setting those roles for young women to look a certain kind of way, even though the models themselves were like, that's really not true, because
Oh,
there's no way.
right.
I can't even look
Right.
at that, but I mean, we say it's cap, somebody else might say it's unrealistic expectations. How people say, post a picture and then relationship goals, knowing that you guys were just arguing 5 minutes ago. So social media is hard. You can't base your life on what you see on social media. It's like you kind of have to find your own lane and go what makes you happy. There is no normal anymore. Whatever you do that works for you and your family and your household that makes you happy.
I definitely think, social media, of course, it could be a blessing and a curse. I'm thinking of the good things about social media. Since the pandemic, there have been a lot of celebrities and artists doing like free concerts. There's a DJ, D Nice, who does these, like, he's up till 3:00 in the morning DJing, and that has created a community. People who are isolated in their homes feeling connected to people. They call it club quarantine. And, there's a lot of different platforms where you can have that connectedness. But of course, it's easy to have the comparison when people are posting the engagements, or when they bought the home, or how they've hustled through the pandemic and things like that. So I definitely think it takes some intentionality on how you use it in effort to manage what you're dealing with.
Yeah, I agree 100%. Like the versus battle. We've all been loving the versus battle. That's helping us all out.
Yeah.
Can we, I know we don't have much time. We got about 10 minutes left in the conversation. So, again, anybody watching, if you want to get your questions in, hurry up, because we're about to wrap this up. But getting back to the holiday season, again, a lot of times we say happy holidays, but it's not happy for everybody. So can we talk a little bit about resources for grief counseling, and just anybody who, again, during this time is not always a happy holiday for them?
So in the state, in Maryland, if you live in the state of Maryland, and even if you don't, I would encourage you to check out our website, bhahealthmaryland.gov. We have a whole host of resources for the community about all sorts of things. Grief resources is one of the things that we have, a sheet of different resources for people to take advantage of, to help them to get through this season. It's a difficult season under the best of circumstances, and this is far from the best of circumstances, right? So that is something that I would encourage people to do. And also, if people do feel like they're in an emotional crisis, we would encourage people to use in the state of Maryland, 211-PRESS-1, which is our warm line where there are crisis counselors there 24 hours a day, available to help you to connect, to get connected, to feel connected. If you're feeling, particularly, perhaps you're feeling desperate, particularly alone, having really, really negative thoughts about perhaps wanting to hurt yourself, or that life would be better if you weren't here. So I would encourage you to use that resource as well. And then also there's the suicide hotline, the National Suicide Prevention Lifeline, which is 1-800-273-8255. So 800-273-8255. That's another wonderful resource. In the state of Maryland, that rolls into our 211-PRESS-1. But again, it's that's a national number that you can call to get access to help, resources, and supports during this challenging time.
Yeah, I know in our church community, there's an organization called griefshare.org, and you can, go to that website, put in your zip code, and it will bring up the group that's closest to you. That's, of course, helped when persons were meeting in person. But now all of the groups are, online, so persons can still find a group that'll help them through their grief and loss. And the Renaissance Center, we have an afternoon of caring and sharing, and that is on this Saturday, and that's via Zoom, so people can register for that. That is from 1 to 2:30 p.m. on December the 19th. And so we do that annually, also having groups for other demographics. We have a young adult group that's getting started, and also planning to do a spouses group soon, because persons are, struggling, and they may not be ready, of course, for grief share or groups. So I always encourage persons to come in individually and discuss it, especially in our community. You know, we grow up with it goes on in the home, stays in the home. So a lot of us have privacy concerns. So we're not comfortable in a group setting. But I know for grief, it is helpful to do one or the other, or do both if you can do both. And Grief Share is free. It's just materials, that you would have to order.
So I'll just add to that. Go ahead.
Oh, okay. And if you're looking for, something to do, because sometimes it's just something that we need to do to kind of bring some life, bring some joy during this holiday season. And I know I go through the grief cycle. Please feel free to reach out to me at RJ Designs, and I'll be happy to put together a box of something for you that you can use to bring a little happiness and share to yourself and your family.
Mm-hmm. Yeah.
I was just going to add that Shepherd Pratt has their crisis walk-in clinic. If someone is feeling like they're in crisis during this time, one website that I always tell people about is Psychology Today. You can easily find a therapist based on gender, specialty, someone who specializes in grief work, but then also recognizing that there's various stages of grief, right? And so knowing that there might be ebbs and flows, and navigating those stages does take time. So using all the supports that you can be really helpful.
Yeah.
Mm-hmm.
I didn't want to cut you off. So there's a really cool app too, I forgot to mention earlier. It's called Happify. So like,
that's good.
It's a great app. Like if you want to do mood training, or, just to kind of help you get in a good space. It has, things that make you appreciate your gratitude for the day, and just how to overcome negative thoughts. It's called Happify. So make sure you check that out. And you can always reach out to me at Beyonce ATL on all platforms.
Now, Beyonce, all these apps you've been putting out, these are free? Are these free?
Yes, those are free apps.
I'm just
not the trial period.
Right. What's the trial on it?
Now, see, there's like apps like the Calm app. And when I looked it up, I was like, oh, you got to pay. I was like, oh. Yeah, there are some other apps, but I tried to, only list the free ones.
Can
Okay,
you give us the other apps that you said earlier, just for the people who they might have tuned in like midway, because they wrote some really good apps. So I just want you to repeat those.
Sam, which is kind of like self-help. Also your iMood journal. For teens and young adults with anxiety, this is a great one, Mind Shift. And if you know someone who needs to talk to somebody, the National Suicide Prevention Hotline, they have a great app. It's called My3. And they can call 24/7, 7 days a week. Someone is always there. Again, it's the My3 app, and it's a great app if you ever need to talk to somebody and just get something off your chest.
Yeah, that's dope. I think this conversation was amazing. I'm so excited about tonight. Angie and I, we was, round 2 with this. The first one was amazing. This one is amazing. Thank you to our sponsors, Shepherd Pratt and NAMI Maryland, for being a part of this as well. And all of our amazing panelists. This was great. Hopefully everybody got something out of this. I know I did.
Definitely. You guys are awesome.
Yeah.
And I think, remember, this holiday season, I can't stress enough to anybody that's watching this, no matter what you're going through, that you're not alone in it, that you're not the only person who feels the way you feel or has been where you've been. And I think, as you've seen with this panel of people here, like, we're all here for you, and whatever that capacity can be. And whether it's something we can help you out with directly, or whether it's us directing you to somebody or some place, you do have support, you do have love. So never forget that. Never forget that your radio family, especially, we love you. And everybody here that you've seen loves you. So just always keep that in mind. I think sometimes we feel alone, even when we got people, even when we're around people, we still can feel alone. Even when we have success, money, whatever, you can still feel really alone. Even when you popping, you might have 100K followers on your IG,
right?
Still feel alone sometimes, and that happens. But there is a better way. There is a way to handle it and deal with it. And hopefully we've been able to show you that. So on that note, we're going to wrap things up. Angie's my name. You can catch me on the Morning Hustle, 6 a.m. to 10 a.m. on 92Q, followed by the one and only, my co-host this evening, Persia. Thank you so much for letting me join you yet again.
Oh, absolutely. I'm super excited. You can check me out right after Angie, of course, in the Morning Hustle, 10 a.m. to 3 p.m. Monday through Friday on 92Q. And shout out again to all of our amazing panelists. And thank you for all the great ideas. I can't wait to go make my playlist right now for the music we do not enter in. And we're just going to do this together.
Yes. And I'm getting them friendship lights. I love the friendship lights.
Love that,
Them to everybody.
Yes. So happy holidays, Linda, Chester. So this was great, and it was great. So thank you so much to everybody for being a part of this, and happy holidays again.
Thank you.
Thank you. Thanks for having
All
me.
right.
All right. See you all. Be safe.
Good night.
Good night.
Mask up.
Yes, mask up. Hello.